Hi guys, it is my pleasure to speak with you today about a topic that affects us all but is often not discussed enough: urination. Specifically, the challenges and potential solutions to improving the quality of our urination habits. As we all know, urination is the process by which the bladder releases urine from the body. In order to do this well, the bladder needs to be well filled, and when it is properly filled, you need to be able to urinate well. The bladder is your body's way of storing and releasing urine, and a normal bladder stretches like a balloon without increasing pressure until it's filled with 300 to 400 cubic centimeters of urine. However, many people are troubled because this process is not normal, causing them to go to the bathroom too often, making them tired, and causing them to be uncomfortable when they have to go on short notice or travel long distances. Sometimes, they even wake up in the middle of the night to go to the bathroom, especially if they need to pee in their sleep. Once or twice is fine, but if it happens often, frequently, or every day, it can have a significant impact on your overall health and well-being. For example, if you're not getting a good night's sleep due to nocturia, the fatigue carries over into the daytime, which can lead to lethargy and depression. Furthermore, you're more than twice as likely to fall and suffer a fracture while going to the bathroom in a dark room, which can be especially dangerous for older adults, posing a serious threat to their health and being a leading cause of death. Many people think that nighttime urination is a natural part of getting older, but this is not necessarily true. If you don't treat it because you think it's natural and it doesn't get better, it can have a significant impact on your aging and immunity. Before you know it, you can't hold your urine and you're incontinent, so you go to the doctor for a diagnosis. Symptoms of difficulty urinating include frequent urination, nocturia, urgency, steatorrhea, delayed urination, short-acting urination, and residual urine. The most common cause of dysuria in men is an enlarged prostate. The prostate gland gradually enlarges with age, and as it does, it compresses the prostatic urethra and blocks the bladder outlet. For this reason, in the early stages of an enlarged prostate, symptoms of urinary urgency, delayed urination, and residual urination occur, and the bladder gradually becomes harder as the bladder muscles thicken due to the obstruction of the bladder outlet. This leads to storage symptoms such as frequency and urgency. The most common cause of nocturia in women is an overactive bladder. Many women mistakenly believe that if they have symptoms of nocturia, they have cystitis. Overactive bladder, as defined by the International Continence Society, is the presence of urgency, frequency, and nocturia in the absence of a urinary tract infection. In women, it is often characterized by frequent or urgent urination and, in severe cases, urge incontinence. These BPH and overactive bladder symptoms don't get better in a short period of time. However, there are daily routines that can help improve your symptoms and your quality of life. The first routine is Kegel exercises. Kegel exercises work the pelvic floor muscles, and they can be done by feeling like you're cutting off a stream of urine or tightening your anal sphincter. Contract your urethral sphincter for 5 seconds and then relax for 5 seconds for 4 to 5 repetitions. Once you're comfortable with the motion, increase the time, contracting the muscle for 10 seconds and then relaxing for 10 seconds. It's better to do this exercise often, every day, rather than all at once. The second option is heat therapy. Heat therapy is particularly effective in relieving BPH symptoms. Taking a warm water bath or sitz bath increases blood circulation, which can help to soften a hardened and constricted prostate. In fact, one study found that after 2 weeks of daily sitz baths for men with BPH symptoms, 60% of men experienced improvement. The third thing is to reduce your alcohol and caffeine intake. You need to reduce your caffeine intake, which is a trigger, and also avoid spicy foods and sodas, which irritate the bladder. Alcohol, coffee, and high caffeine beverages can cause nocturia and should be avoided as much as possible. The fourth and final tip is to cut down on salty foods. When excess salt accumulates in the body, the kidneys work harder to flush it out in the urine. Eating salty foods can cause you to drink more water, so get into the habit of eating fresh. It's also a good idea to eat foods that are normally good for urination. Reduce your intake of fatty foods and red meat, and eat lots of fiber-rich fruits, vegetables, and fish oils. Now, let's take a closer look at some specific foods that can help improve urination. The first food that can help improve urination is green tea. Catechins, which are found in tea, are a type of polyphenol. They are also found in black and oolong teas, but are reduced during fermentation, so it's best to get them from green tea. The catechins in green tea inhibit the progression of cancer cells and have anti-aging, heart disease prevention, high blood pressure prevention, and antiseptic properties. In China, green tea is a popular drink, and studies have shown that men who drank green tea consistently were 2/3 less likely to develop prostate cancer than men who didn't drink it. The second food is tomatoes. Lycopene, a type of carotenoid pigment, has anti-cancer properties. It's similar to carotene, which is the most effective at scavenging free radicals, so it's also good for skin aging. While tomatoes don't have a direct therapeutic effect on urination disorders that have already developed, they do have a protective effect against worsening, helping to prevent the progression of cancer, especially prostate cancer. It is recommended to eat them in the form of juice, soup, sauce, etc. to increase absorption. The third food is pumpkin and pumpkin seeds. Lycopene, a carotenoid in pumpkin, has high antioxidant power, which helps prevent and treat diseases caused by free radicals. It also contains omega-3 fatty acids, zinc, and more. And pumpkin seeds are rich in polyphenols that reduce bladder pressure, which can help relieve frequent urination. Fourth on the list are berries. The anthocyanins and flavonoids in berries like strawberries, blueberries, and raspberries are powerful antioxidants that help fight off bacteria and bacterial infections that cause UTIs. Finally, there's celery. Celery is a great food for both the bladder and kidneys. It relieves discomfort before and after urination and lowers uric acid levels in the blood. Even if the condition itself isn't life-threatening, it can make everyday life difficult and significantly reduce your quality of life, affecting you in many ways. Mentally, it can lead to depression, increased shame, and avoidance of interpersonal relationships, so it's important to take care of yourself. In conclusion, improving the quality of your urination habits is crucial for maintaining overall health and well-being. By following simple routines such as Kegel exercises, heat therapy, reducing alcohol and caffeine intake, cutting down on salty foods, and eating foods that promote good urination, you can significantly improve your symptoms and enjoy a better quality of life. Additionally, it's important to seek medical attention if you experience persistent or severe urination problems, as they may be a sign of a more serious condition that requires treatment. Remember, urination is a natural and necessary bodily function, and there's no need to feel embarrassed or ashamed about discussing it or seeking help for related issues. By taking care of your bladder and urinary system, you can enjoy a happier and healthier life. That's it for our health talk today. If you found it interesting, please subscribe 5 Minutes Health Talk channel and don't miss out next story. Thank you, have a great day.